So you already know that we treat very differently here at Rehab and Revive. And if you don't, you can watch more about our treatment methods up here. But today I'm here to talk to you about why we can't treat the way we do in network. We don't actually accept any type of insurance here. However, if you have out-of-network benefits, you may be able to submit your own claim for partial reimbursement. That's probably the biggest question I get here, is why we can't treat the way we do in network for an insurance company. The reason being is that if you were to go to a traditional physical therapy office that accepts insurance, they would submit a claim to your insurance and you would be authorized for a certain amount of visits. That means that your insurance company, who's never actually met you, they don't know your case, they don't know your needs, they determine how many times and how often you can go to physical therapy. Here at Rehab and Revive, we want to have a relationship with you as a person, not with your insurance company. So we want you to be able to decide how many times you come here, if you want to continue coming here, and if you're not better in the amount of times that they think you would need, we'll continue treating you until either you're better or you decide to stop coming. Here at Rehab and Revive, we get our patients better 3 to 4 times faster than traditional in-network physical therapy offices. This has the potential to save you time and money depending on what your insurance benefits are. So if you were to go to a traditional PT office, you would need to go in for an evaluation. You would go in and you would see the doctor of physical therapy and spend maybe 30 minutes with them, and they would assess what kind of treatment they were thinking you would need. After that, every other visit would most likely be with a PT aide, not the actual doctor of physical therapy. They're going to walk you through some exercises, you're going to be on a treadmill, some other machines, depending on what your case is like, and they might do a little bit of massage, electrical stimulation, ice, you'll go home. The next time you'll see your DPT won't be for several more visits, most likely. And when you do see them, it's very minimal treatment and it's mostly just them checking in to see your progress. How much progress can you really get though from exercises? Not much. That's why insurance companies and doctors recommend you go 3 times a week for 5 weeks. They need you to go that often because you're only getting this much treatment every time you go in. Here, you'll come in and you will never see someone other than a doctor of physical therapy. There might be an intern with you, but they won't treat you. There's no machines here. It's not heavily exercise based. We don't want to do anything here that wastes your time that you could do at home. So if it's an exercise, it'll be homework. If it's going to the gym, that'll be homework. We like to utilize your time here with the doctor and you'll be receiving actual treatment. So whether that's manual therapy, neuromuscular re-education, if you want to watch more videos about that or read more, you can find that on our website. But here you get 4 treatments of a traditional physical therapy office in one because you're seeing your doctor for the full 45 minutes that you're actually here. So of course we get people better 3 to 4 times faster. We give you the time and we tell you, we'll work with you in your schedule. It's very difficult to get to PT 3 times a week for an hour. That's not including the drive there, the drive home. If you're doing exercise and you need a shower afterward, that's a lot of time out of your day. And we understand that. So we work with you in your schedule to get you better in the best way for you and what's most convenient for you. That's not always coming in 3 times a week. If you can only come in once a week, we'll do double sessions. If you can only come in on Fridays, we'll block times for you on Fridays. We can treat you however works best for you. We're not told you can only see the DPT for 15 minutes because that's all your insurance will pay for. We'll see you however long we need to see you to get you better. Here we give you the power to decide what kind of investment you want to make on your health. Your insurance company doesn't get to decide it for you.